Hello, this is Ryan and this is my sim 1. So I'm wearing my unofficial storm blue scrubs and I have shaved my facial hair. I have secured my hair. I have my ID badge here. This will do for now. And my watch. I removed all my jewelry and I did not wear any scented lotion or cologne or perfume. I have worn appropriate shoes and this is my sheet here. So what I'm going to write is temperature, pulse rate, otosat, blood pressure, name of patient, and age. I have my I, H, S, E, TPR, O2, and BP. For my general survey, right, physical appearance, I have behavior, and my mobility. Okay. Physical appearance, I have overall appearance, I have hygiene, I have skin and lesions, I have body structure and development. For behavior, I have facial expression, I have level of consciousness, I have speech, and for mobility, posture, gait, and range of motion. Alright. So this is what I have written. Okay, now I'm going to greet my patient. Hello, Shara. My name is Ryan, your Bachelor of Nursing After Degree Program student nurse. How are you doing today?
I'm good. How are you?
I'm good. Thank you for asking. So you came in for a routine assessment. Do you have any questions for me?
I know.
Perfect. You can just walk this way, please. Thank you. You can just make yourself comfortable. So there are just a few questions I'd like to ask you before we begin. Is that okay?
Mm-hmm.
Alright. Can you tell me your name and date of birth?
Shara Gortel, July 28, 1987.
How old are you?
33.
Okay. Can you tell me where you are right now and what time it is?
I'm just at home and it's 10 in the morning.
Alright. Thank you. So before we begin, I'd like to wash my hands first and do hand hygiene, and I'll be back in a minute. Alright?
Okay.
Thank you. Now I'm going to do hand washing. First I'm going to use soap, then for the alcohol-based hand rub. So for the soap, first I need to make sure that I have removed all my jewelry and that I have pushed my watch up my wrist if there is a watch. And now I'm going to turn on the water, the warm water. I'm going to rinse my hand thoroughly, pointing downward. I'm going to dispense soap, the product to the palm of one hand, making sure coverage of all hand surfaces, palm to palm, right hand over left dorsum and vice versa, palm to palm with fingers interlaced, back of fingers to opposing palm and vice versa, rotational rubbing of left thumb clasped with right palm and vice versa, rotational rubbing forward and backward of right hand over left palm and vice versa. I'm going to clean my wrist here. I'm going to rinse my hands thoroughly. I'm gonna use a disposable single-use towel. This will do for now. I'm gonna dry my hands really well. I'm going to use the towel to close the faucet for water and discard the tissue appropriately. Now my hands are clean. Next, I'm going to use alcohol-based hand rub. Is that recording? Okay. First, I'm going to make sure my hands are not visibly soiled and they are dry. And I have removed my jewelry and accessories are not in the way. So I'm going to dispense product to the palm of one hand, ensuring coverage of all hand surfaces. I do palm to palm, right hand over left dorsum with fingers interlaced, and vice versa, palm to palm with fingers interlaced. And I do back of the fingers, opposing palm, and vice versa. Rotational rubbing of left thumb clasped with right palm, and vice versa. Rotational rubbing forward and backward of right hand over left palm, and vice versa. And I do my wrist. Now my hands are clean. Now that I've washed my hands, I'm going to clean my stethoscope. And I'm going to do this for a point of care cleaning prior to contact with patient. And I'm going to use, for Sphere Labs, I'm going to use Lysol wipes. And for clinical, I'm going to use the Cavi wipes. Now I've washed my hands. So before we begin, I'd like to do a health teaching. Is that okay with you? So how many times do you wash your hands?
As often as I could possibly be.
Alright. So according to AHS, we have to have 5 moments of hand hygiene. So what this means is that there are 5 times we have to wash our hands, especially in the workplace or in the hospital. So first moment is when, before we come in contact with a patient or client. For example, like taking the blood pressure. So now I have washed my hands. Second is that when we are doing a clean or sterile procedure like insertion of NGT and Foley catheters. So we have to wash our hands before we do that. And the third time is when we are exposed to body fluids like secretions or vomit, anything like that. So we have to wash. And fourth time is when we are in contact with the patient and we do procedure. And the fifth time is when you're in contact with the patient's environment, like the bedside table or the curtains of the patient. So those are the 5 moments when we have to do hand hygiene. Do you have any questions for me?
Well, why don't you just wear gloves?
Okay, good question. So nurses or care aides are going to wear gloves depending on the client's case. So if the client has a communicable disease, meaning the client can infect other people, like with skin diseases, that is for contact precaution. That means that we have to wear gloves. But for certain people, it's okay to take the blood pressure or the vital signs using bare hands as long as we are washing our hands.
Okay.
Alright, perfect. So we can begin with our assessment. So I will begin by taking the tympanic temperature. So do you have any questions for me at this time?
No.
So first what I'm going to do is that I'm going to show you a tympanic thermometer. So this is what it looks like. So I'm going to insert this to your ear of preference, and you're going to hear a sound and it's not going to hurt you. Okay? So, are you ready? Can you just sit comfortably and turn your head to the side? I'm going to insert a disposable single-use probe, and I'm just going to pull your ear, your pinna up, back and outward, and I'm going to insert the speculum snugly to the direction of the nose. We're going to hear a sound, and I'm going to put it there until you get the reading. Okay, the reading is 36.3, which falls within normal range. I'm just going to write it down. So, the temperature reading indicates that the normal range would be 36 to 37.5 for the normal range. So you fall within the normal range. That's great. I'm just going to dispose this tip here. I'm going to do is I'm going to take your pulse rate, and I'm going to do this by taking the radial pulse. So do you have any questions for me at this time? can you just sit comfortably and you can just put your hand to a 90-degree angle, or you can put it on top of the table, preferably the left hand because it's direct to the heart. Is that okay? Great, thank you. So what I'm gonna do is I'm gonna palpate using the pads of my index and middle finger. I'm gonna push the artery to the bone gently. I'm gonna flex the wrist to take maximum pulsation. I'm gonna count to 30 seconds. Okay. So next I'm gonna take your pulse rate, and I'm gonna do this using the radial pulse. Okay. Next I'm gonna take the pulse rate, and I'm gonna take the pulse rate, and I'm gonna use this taking the radial pulse. So do you have any questions for me? Okay, can you just put your hand to a 90-degree angle, or you can just put here on top of the table, and you can just use the left hand if that's possible, because it's more direct to the heart, right? Okay, so what I'm gonna do is I'm gonna palpate using the pad of my first and middle finger, and I'm gonna push the artery to the bone gently, and I'm gonna flex your wrist to feel maximum pulsation. Okay, I'm gonna count 30 seconds to 1 minute. Okay, what I was able to take from your pulse is that it was 75 beats per minute. It was strong and it was regular. And if it wasn't regular, I'm gonna take it to a full minute using the apical pulse and using my stethoscope. So the range falls within the normal because it falls from 60 to 100 for an adult. What I was also able to take is your respiratory rate, which is I was able to take it discreetly because if you told the patient that we're taking the respiratory rate, and it's going to alter the result because they're going to be conscious. So what I was able to take is that your respiratory rate is 19 breaths per minute. It was regular, it was deep, and it was easy. Okay, the normal range would be from 12 to 16. So how are you feeling right now? Are you tired or?
A little tired.
A little tired? All right. So we're going to take note of that. What I'm going to do is I'm going to take the oxygen saturation, and I'm going to do this using a pulse oximeter. So what I have here is a pulse oximeter, and this pulse oximeter is what I'm going to use to insert to your finger, and you're going to hear a sound. It's not going to hurt you. It's just like putting a clothespin to your finger. So have you ever tried this before?
Yes.
Great. So can you just give me your finger? I'm going to put the pulse oximeter. I'm just going to wait, and I can hear a sound, and I can hear a sound. It's 96%. So 96% falls within the normal range. The normal range is 96 to 100%. So that would be great. Next, we're going to take your blood pressure. So do you have any questions for me at this time?
No.
Before we do this, I'd like to know, did you smoke, eat, or exercise 30 minutes prior to this assessment?
I know.
Great. So just sit comfortably and with your feet flat on the floor, with your legs uncrossed. And you can just put your hand at the heart level here. I need to know, do you have any injuries or shunts in your hands?
No.
Great. So what I'm going to use is a two-step method. I'm going to inflate and deflate the blood pressure cuff twice. So what this does is it makes sure I do not miss the upward sounds.
Okay.
Alright, so can you just put your hand here, with your palms facing upward? Okay, I'm just going to measure the BP cuff that it is appropriate to use. I'm going to pull up your sleeve there. It should wrap around 40 to 60% of your arm, which it does, it's around 50%. And the BP cuff bladder width should wrap around 80 to 100, which falls around 100. Also, the BP cuff bladder length should be 2/3 of the length of the arm, which it is, so this is an appropriate cuff to use. I'm just going to feel 4 pulsations first, your brachial artery. I'm going to position the cuff 2.5 centimeters above that. Keep it snugly and center it in the brachial artery. So with the swivel manometer at eye level, I'm going to close the valve. I'm going to relocate the pulse. I'm going to inflate the cuff quickly and note where it disappears. So I feel it disappear around 100 millimeters mercury. So this is our estimated systolic blood pressure. Okay, we're going to wait 15 to 30 seconds.
Also a question. So like say the hospitals right now uses the electric ones.
Yes, they do, and I understand that it's more convenient, but this is more accurate. Nurses tend to take the blood pressure again to check if what the automatic blood pressure is taking correctly. So this is, I think, it's better to use for now. Okay. So you close the valve. What I'm gonna do is I'm gonna use my stethoscope now. Position it on my ear. Make sure the sounds aren't muffled. I'm going to use the diaphragm. So I'm going to position the diaphragm on the brachial artery. So what I was able to take is 90/60 millimeters mercury, and prior to that I felt your pulse disappear at 100 millimeters mercury. So 90/60 falls under the normal range, but with cultural considerations and of course the patient size, then we have to do some consideration for that. So what I did there was that I positioned my stethoscope to the brachial pulse, and I put it in my ear, and I quickly inflated the BP cuff 30 millimeter mercury above the estimated systolic blood pressure, which was 100 millimeter mercury, and I deflated it 2 millimeter per second, and the first sound that I heard was around was in 90 millimeter mercury, and the last sound that I heard was in 60 millimeter mercury. So her blood pressure is 90/60. And thank you so much for your cooperation. So this concludes our assessment Thanks for being here. So do you have any questions for me or concerns at this time that I can help you with?
No, I'm good, thank you.
Thank you so much.
Mm-hmm.
Have a great day. Have a good day.
You too.
Bye.
Bye-bye.
Alright, so now I'm going to begin with the general survey. So first I'm going to start with the physical appearance. The patient appearance is appropriate to age, which is 33 years old. The patient's body and face is symmetrical. The patient looks somewhat tired or drowsy. And for hygiene, the patient's clothing is appropriate to age, gender, context, culture, and the weather as well. And there was no body odors noted. The skin, hair, and nails were clean. And for skin and lesions, there were slight pigmentations on the face of the patient. The patient looks pale. Skin tone was even. For body structure and development, the physical and sexual development was appropriate for age and culture and gender. And there were no joint deformities that were noted. Body structure was symmetrical. For behavior, the facial expression of the patient showed that she was somewhat tired or nervous. She was calm, and for the level of consciousness, the patient was able to recall the patient's name, the place, the time, the date of birth. So that is times 4. And for the speech, also the client was alert and awake. So for the speech, Alright, so now I'm going to begin with my general survey. First I'm going to start with the physical appearance. The overall appearance of the patient looks that she looks appropriate to her age, which is 33 years old. And her face and body was symmetrical. The patient looks tired or drowsy. And for hygiene, the patient's clothing was appropriate for age, gender, context, culture, and weather. The hair and skin, nails were clean, and there were no body odors that were noted. For skin and lesions, there were slight pigmentations on the patient's face, and the skin tone is even, and the hair was evenly distributed. For body structure and development, it was appropriate for client's age. Sexual development was appropriate for client's age. Also, there were no body deformities or joint deformities that were noted. For behavior, facial expression showed that the patient was kind of nervous, and she was drowsy or sleepy and tired. She was calm. So level of consciousness, the patient was able to recall her name of the patient, date of birth, the place, the time. So that's times 4. And the patient was somewhat drowsy. So speech, the patient's speech was consistent. The speech was appropriate. She had a good choice of words. And for the mobility, the patient's posture was sitting upright. Time to time, she would be slouching, and her gait was that she was walking unassisted or unaided, and she moved freely without signs of any limitation for her range of motion. And that concludes my general survey for today.